J. Oviedo, Director of Robotic General Surgery at the Houston Methodist. Welcome, Doctor. How are you?
Thank you, Sasha. Thank you, Leila. It's a pleasure to be here on the show and to greet the audience. It's a pleasure, and I hope everybody's having a blessed Memorial Day, and that we remember our fallen soldiers and everything that they have given for our country and our freedom.
Yes, and continue to do so. So thank you.
Yes, so thank you for inviting me. It's a pleasure.
Thank you for coming and taking time out of your busy schedule to be
on
here
our
with us.
holiday, so
Exactly. The day that you get off, you're here with the Chai Time Girls. So we appreciate that.
I enjoy. And thank you so much.
Absolutely. So our topic for today is on robotic surgery, which is, I'm very intrigued about that because, I mean, we are in the future, right? And there's so many things that are changing. I think, very soon we'll be driving in air, having flying cars and such. So it's very, I feel like robotic surgery is the next thing. And it has been for a while, you said.
Exactly,
Yes.
Sasha. It has been. And the interesting thing is we hear the term robotic surgery, and sometimes we think it's coming, it's in the future. But in reality, we have been living in the robotic revolution in surgery for the last 2 decades. It's really interesting.
Oh, wow.
And in the United States, is leading the way in the world with the robotic technology, but there are other countries that are already catching up, and it's becoming a really interesting competition with other robotic platforms from other places in the world. And we'll be talking about that a little bit as well.
Yes. So what is robotic surgery and how does it work?
Excellent question. So to understand what robotic surgery is, let's go to the principle, robotics. So the word robotic or robot came from a Czech term at the beginning of the 20th century. There was a writer who wrote about these machines that were automatons that would be present in factories and would perform the duties of human beings. At the end, these machines rebelled against the humans, and that's another story. But even though they had a negative connotation at the beginning, the principle was autonomous beings that were performing human tasks. So the word was robota in the Czech, and that was taken in the literary works of the 20th century, and then later it was applied by engineers, and now we talk about robots that perform portions of the operation or the entire operation, but without complete autonomy. And so a robot used for surgery, many experts consider that to be not a true robot. They think it's just computer-assisted surgery. What does it mean? Picture this. You are the surgeon, Sasha. You're sitting down. You're very comfortable. You're not standing up. Your back is not bent. Your neck is comfortable. You have your eyes attached to a couple of lenses, or with a special 3D augmented reality glass or lens that moves according to your retina movements, and that moves the camera inside the patient. And we have little incisions on the body, and very small. It's like it's laparoscopy, basically, minimally invasive surgery, but with enhanced instruments. In laparoscopy, the instruments are straight sticks. So they have some degree of motion. They can move a little bit, but for the most part, they're straight, and there are limitations to what we can do as surgeons. But robotic instruments are more sophisticated. You see, they are straight at the beginning. They go through little channels through the abdominal wall or the chest, but then at the very end, they have little joints that allow them to move like the human hand.
Oh, wow.
So they move with better degrees of freedom than our own hands. Because of that, then we can operate that machine, and the machine replicates our movements. So the surgeon is in control, not the robot.
Right.
We are the ones who perform the surgery, but we're comfortably sitting down a few feet away from the patient. We're in a console, almost like driving a jet. Like flying an airplane.
Oh, wow.
And we have controls for our hands, controls for our feet. So instead of using only our 2 hands, we're using all 4 extremities. We're using both feet, both hands. We're using our eyes. And then we can control every movement of that robot.
Yeah.
It's not autonomous. That's the interesting thing about it. Now, if you ask me, is it true of all robots to act that way? No. Actually, there are robots that are already exhibiting certain autonomy and are performing tasks of the operation by themselves.
Wow.
And I think the future will hold that.
Oh, wow. When you said in the beginning of the conversation, I thought instantly went to the movie iRobot.
Yes.
With Will Smith. I was like, oh God. And then you calmed me down. And then when you started saying that we're using like, it's kind of like a video game basically.
Yeah.
True.
But
true.
on a real human.
Exactly.
But that's amazing that, we've come so far.
It's amazing, and in fact, it's been present in the United States since the year 2000 when it was approved by the Food and Drug Administration, the FDA.
Oh wow!
Now, in other countries, it was already present before. As you know, in the U.S., it's very rigorous. It's very difficult to get things approved by FDA.
Absolutely.
But in other countries, it was already being used.
Oh.
The American company that made it
Right.
was already testing it in other countries.
Oh, wow.
In the U.S., 2000, and then ever since then, it's been a revolution. It's everybody at the beginning, only very few surgeons were learning how to operate with the robot.
Yeah.
Nowadays, it's becoming the norm. It's really interesting. Just like we were seeing with the laparoscopic revolution in the 80s and 90s. You see how many surgeons who performed open traditional surgery were opposed to that, and we're trying to block that revolution from happening. Now we're seeing the other phenomenon.
That's really cool.
And more people are accepting it.
Yes.
And more surgeons coming out of training. We have a residency program at Houston Methodist, and we're training all of our residents and fellows to operate with the robot. So now the patients, the audience, the members of the audience who will become patients at some point, they should expect that their surgeons should be able to perform robotic surgery.
That is very, very cool.
Yeah.
So what kind of procedures are done with robotic surgery?
So in the realm of general surgery, which is one of my specialties, any type of procedure ranging from the esophagus all the way down to the rectum.
Oh, wow.
Or even the anus. So anywhere in the GI tract, stomach, small intestine, colon, rectum, all the way from the abdominal wall, hernias, abdominal wall reconstruction, down to the tissues closer to the back. Example, pancreas, kidney surgery, ureteral surgery, etc. And then if you take other specialties like urology, bladder surgery, prostate surgery for cancer, kidney surgery, you go to gynecology, uterine surgery, hysterectomies, different things for ovarian cysts, for example. Tubal ligation could be done that way, but when it's performed for other reasons, not just by itself. And then if you think about other specialties that you wouldn't normally think about, like ENT, otolaryngology, ear, nose, and throat, they actually perform incredible surgeries in the neck from little incisions made on the lower lip. So the patient doesn't even have any scars because they make the incision in the lips. And then talk about orthopedic surgery. Even orthopedic procedures are being done with little robots that perform surgery for the joints, like arthroscopy.
Wow.
So it's really
And it's
incredible.
very minimally invasive.
It's the least invasive surgery you can think of, because if you think about it, Sasha and Leila, what happens is you operate with this machine with through tiny incisions with very small instruments, but with finesse, with precision, with movements that are even superior to those of the human hand. So it's the closest thing we have to open surgery principles in the least invasive manner.
Wow.
So recovery is outstanding. Patients recover very fast, and
What is the recovery? Like
it's for example, let's say that I'm doing a big abdominal wall reconstruction on somebody who has a very large hernia, that hernia is causing symptoms, and I perform this big reconstruction with mesh, and I put together the muscles and the abdominal wall, and I do this thing called component separation when I split a couple of muscle layers to be able to bring the abdominal wall in the middle without tension. All of that, if I were to do it open, that would take at least 7 days in the hospital, something like that, because it's painful. If I do it with a robot, my patient is leaving the next day.
Oh, wow.
That's
and it's just
crazy.
incredible. And other abdominal wall reconstructions that are not as complex, same day surgery. Same day surgery. Colectomies, colon surgery for cancer, for example. Open surgery, 5-7 days in the hospital. Robotic surgery, if you do a colon operation, 2 days. Nowadays, colon and rectal surgery specialists are already doing colectomies, same day surgery. They send the patients home the same day. It's just incredible how much we have advanced.
Yeah, that's amazing because, especially with the way things are going on with the pandemic and stuff, people don't want to stay in the hospital for a long time. And
Exactly.
people need beds to be available for other
Yes.
important things.
Yeah.
So I feel like this is so amazing that those that need a surgery that has to have it done, then this is like the best option to go with.
It definitely is. Now, I would say, does it substitute human judgment? Does it substitute open surgery or laparoscopy? Not at all. It's just, I always tell my residents and my trainees, and this is coming from being the director of robotic general surgery, you would think I would push robotics all the time. Not at all. I tell my trainees, you need to learn everything. You need to learn robotics, need to learn laparoscopy, endoscopy, open surgery. You need to be able to do it all so that you can offer your patients the best. And what happens if the robot breaks down one day and it's not available? Or what happens is if another specialist is using the robot? They need to be able to know all the modalities, right?
Yes.
But I think, honestly, it's an incredible tool that we have. It's one more tool that surgeons have to learn as part of our toolbox. And I think we should all learn it. And patients should ask their surgeons, are you robotically trained? And what can you offer? And I think, I'm not saying say no to a surgeon who's not robotically trained, but you should expect that most people coming out of training now will be. And it just really makes the surgeon's work and life easier because it's more ergonomic. As you know, ergonomics has to do with the efficiency of work, right? Ergonomics is the economy of work.
Yes.
How efficient are we performing our job?
Yeah.
Okay, so an example, you know how years ago when people were having issues with carpal tunnel syndrome, typing on the keyboard, then they made these keyboards that separate themselves and it's more ergonomic, right? You can do your job better. Now they have these standing stations to do your work desks, right? Okay, so robotics is similar. I could do laparoscopy, minimally invasive surgery, which is great. We teach it. But at the end, my joints hurt. I'm standing up. It's tedious work. There's a lot of torque. And with the obesity epidemic in America, with so many patients suffering from obesity, which is a disease, it's not their fault, it's a disease, then the surgeons suffer. I don't know, we don't talk about it, but surgeons have lesions too and injuries, wrist problems, neck problems, joint, elbow problems, right? So with the robot, it actually preserves the life and health of the surgeon because we're comfortable, we're sitting down, we're relaxed. We can perform more complex procedures in a day than before because it's not because we're speeding, it's because we're more comfortable.
Exactly. Yeah, that makes sense. Oh, wow. So what are the risks and benefits associated with robotic surgery?
Good. So the risks are the same inherent risks that are related to any surgery. Robotic surgery doesn't put patients at any higher risk than any other operation. In fact, the risks are minimal and less compared to other types of procedures, simply because the surgeons have more control. And control, surgeons love control. We want to be in control, as you can imagine. So what I mean by that is having many arms that you can drive at the same time, not just your two human arms. We have 4 mechanical arms that we can drive at the same time. Because of that, the risks are minimal. If you think about it, we can control bleeders. If something is bleeding, we can control it quicker. We don't panic. We have more control. We have graspers that can grab a blood vessel that is bleeding. We can sew with suture. We can have energy instruments that are very advanced. So we rarely have to convert to open. With laparoscopy, sometimes you have to convert to an open procedure. Robotics, extremely unheard of. Okay, so it's very, very rare to do that. So the risks are really bleeding, for example, but it's less than what you see with other modalities. Infection, extremely low. If you are putting together 2 organs, there could be a risk of a leak, like exactly what it sounds, leaking fluids from inside the GI tract into the abdomen. Extremely low risk. So in fact, robotic surgery decreases the risk of leaks. And so it's just, now the benefits are multiple. All the benefits of minimally invasive surgery, faster recovery, better pain control, less dependence on opiates and narcotics. You don't have to take those medications so much. Faster return of bowel function. That's an important one. So, you know, when you have an operation in the abdomen and your surgeon asks, have you passed? Have you had a bowel movement? Things like that. So it's important because it means that your GI tract is working again. But, you know, cosmesis, sure. We can make beautiful, tiny, tiny incisions instead of a big open cut. But if you ask me, Is that as important as the effect on the inflammatory reaction on the body? I would say no. I think all of those things are great and noble, right? So faster return to work, and a faster return to exercise. Sure, all of those things are important, but nothing compares to the fact that the inflammatory response from the body is less when we do robotic surgery compared to other modalities. What do I mean by that? The inflammatory response means that your body is being attacked, so to speak.
Right.
So surgery is like an injury to the body. It's almost like being in a car accident, right? So you're feeling the effects of an insult on your body, and your body responds normally by defending itself. It's the inflammatory cascade. So what happens with robotic surgery is you can make 7 tiny scars throughout the abdomen and perform a big complex operation, and the inflammatory response will be much less compared to the response from a big open incision. And it's almost like tricking the body into thinking there was no surgery at all.
Yeah, it's like a cut.
It's almost like nothing happened to you. It's just a little cut.
So when you do these surgeries, are the patients asleep?
Yes.
Okay.
So they are under general anesthesia.
Okay.
So we have to rely on our anesthesia partners because it follows the same principles as laparoscopy. So general anesthesia, we use CO2, carbon dioxide, because it's an inert gas. It's fast. It's easy to absorb by the body. It doesn't cause any injury, any harm, and it's something that is already present in our atmosphere. So we use CO2 to be able to expand the abdomen because everything is collapsed on the inside. If you were to put an instrument or a camera, you wouldn't see anything because everything is packaged and collapsed. If you use CO2, the abdominal wall expands, and now you can see the organs really well. So because of that, we're using CO2, and that has an effect on the blood return to the heart. Then the patients have to be asleep. They have to be under general anesthesia, completely relaxed. But most procedures that we perform don't take too long. I mean, probably the longest ones are perhaps cancer cases that are very difficult, but for the most part, you're looking at 30 minutes of surgery to 3 hours at the most.
Oh, wow.
And of course, if it's a cancer operation, more complex, it could take longer.
And each type of surgery has a different recovery time?
It depends on the procedure. For example, if I were to do an inguinal hernia on somebody, recovery is super fast. But if I were to do a big abdominal wall reconstruction with the component separation technique I described and all of that, then it's a little longer, maybe 4 days or so. But when we say, Sasha, this recovery, we don't mean lying in bed all day. It means just feeling like nothing happened to you. Okay, but it doesn't mean you're going to be lying in bed. From day one, surgeons expect our patients, and we encourage them to walk. Walking is important to be able to recover faster. You'll be able to climb stairs for the most part. You can do your activities of daily living, except heavy lifting, because heavy lifting may provoke a hernia. Okay, so heavy lifting is, you abstain from heavy lifting for about 3 weeks or so. That way you don't promote development of a hernia. But other than that, you can be with your children. You can do your activities of daily living. If you have pets, you can take care of your pets. Just don't carry them, right? Depending on the weight.
Oh, very interesting.
With the robots, are they programmed to do certain surgeries, or you have one dedicated for one surgery and then one for the other, or one robot can perform all?
Exactly. One robot can perform all procedures because the one who performs the procedures really is the surgeon. The robot is simply the tool. The robot is almost like an extension of my hand.
So you're guiding it.
Exactly. You guide the robot. Now, there are robots, as I mentioned, though, that already exhibit a degree of autonomy, and they're being used for different specialties to perform portions of the procedure, not the whole thing. And the future is more where I'm going to tell you what my vision of the future is, and it won't be the future for everybody. We have to understand that in other countries that's not going to be possible because it'll be extremely expensive. But the future for industrialized countries, developed countries, may be that surgeons will perform, if not the whole thing, portions of the operation. They will be supervised by surgeons, where surgeons can take over at any point. Or surgeons may be performing the procedure with the robot as a team, and the robot with artificial intelligence may tell me, be careful, don't do that. You should consider doing something different, and then that'll stop me from doing something. Because we are combining artificial intelligence with augmented reality and with virtual reality.
Yes.
We're now training our trainees to practice the procedure in a virtual environment so that they know all the steps, and by the time they go to the real thing, they go to the patient, they have already rehearsed it.
Wow.
And so that's another application of robotics combined with imaging technology with artificial intelligence.
That's pretty cool. You kind of took me back to, I don't know if this was a commercial that I had seen or if this is a figment of my own imagination. Maybe I dreamt it. Was a surgeon sitting at a beach and he's on a laptop or an iPad and he's doing a surgery while the patient is somewhere else with the robot.
True. And you know what? And that may become the future, but mostly I would say for developed countries or countries that have the capabilities of telerobotics, telesurgery.
Yeah.
Wow.
You know what I mean? Like having a powerful network of satellite technology that will enable you to perform a procedure, and within milliseconds, it'll be performed on the other side of the world.
Yeah.
And so it has a lot of interesting applications, for example, in the military. On this Memorial Day, when we remember our fallen, our heroes, in the military, imagine how many lives could be saved if there are no surgeons available at a special military hospital or base.
Yes.
Well, if there is a robot, one of us could perform a procedure on a soldier, on a wounded soldier from the U.S. With a powerful network, satellite technology, we could do it.
That would be so wonderful.
Yeah, it's giving me goosebumps just listening to it, right?
It's
I feel like I'm
incredible.
in a sci-fi movie.
Exactly.
And it's coming. It's coming.
Exactly.
It's
We are
just
there.
there are experiments that are already being conducted and studies, and we perform some of those at Houston Methodist, and so in the future we'll see that. And now, of course, it has some legal implications
Yes,
too,
of
because if you
course.
think about it, there was one case documented in the world. Maybe it's been done by other people, but only one was documented of telesurgery. It wasn't robotics, but telesurgery. It was actually a one specific robot. It was telerobotics performed from one side of the world on a patient on another side of the world, but there were some disadvantages, and that had to do with the network. There was a little delay,
Yes.
Oh.
more than 5 milliseconds, and that has an effect. If you think about it, if you had a bleeding vessel and you had to control it, and you take longer than normal, or the machine takes longer than normal, that's going to be an issue.
Yeah.
That doesn't happen here in the U.S., but if you're doing telerobotics, so we have, that was years ago, by the way. Now the
Like,
technology.
what if your Wi-Fi connection cuts off?
Absolutely. But there are also legal implications.
Of course.
So if I am an American trained surgeon, I'm performing surgery on somebody in, I don't know,
India. Yeah.
and am I following American laws or am I following Indian law?
Yes.
And it gets really complex,
Yeah,
right?
right.
Yeah.
there.
Never
No.
think about it,
Yeah.
but then that you say, I'm like, oh yeah, that's true. It
Right?
could be a problem. Yeah.
If there is a problem, God forbid, right? So who takes over? And then our American attorneys would have to speak with the Indian attorneys, and so
Oh,
it
God.
becomes really interesting.
Yeah.
So
Y'all have to think about so much,
The
right?
broader
Like
spectrum of it.
just not the surgery part, but the legal part, right? The
ethical
science,
implications.
and then
ethical as well, of
yes.
course, right?
Yeah.
So
Wow.
specifically because maybe the patient has never met the surgeon in America in person, right? So
Yes.
how do you do that? Is just a virtual visit? Will that be enough? Et cetera,
Yes,
right?
Absolutely. Oh wow.
Yeah.
So I think you have answered this, but just I'm gonna ask you again. How is robot assisted surgery different from the traditional surgery? And obviously we know how the surgeon is involved, but if you can explain that one more time.
I think robotic surgery is different from traditional surgery, mostly because of the control issue.
Okay.
When I was a younger surgeon, fresh out of training and doing my first robotic cases, I went to a conference where there were surgeons at my stage at that point, years ago, and surgeons who were seasoned surgeons who had done thousands of robotic surgeries, okay? And one question that was asked was, what do you guys think among the audience members, what do you think is the main advantage of robotic surgery? And most of the younger surgeons like me were saying, okay, I think it's the finesse, the precision, the way the instruments move, we can suture better. And then the seasoned surgeon said, we don't think so. The main reason is control.
Okay.
Okay, so
I'm going to have you hold your thought for 1 second.
Yes, absolutely.
We have to take a quick break. When we come back, we'll continue this conversation with Dr. Oviedo from Houston Methodist.
You're listening to the Chai Time Show on 99.5 FM.
Welcome back to Chai Time on 99.5 FM. For those of you that have just tuned in, we are in conversation with Dr. Oviedo, Director of Robotic General Surgery at Houston Methodist. And before we went on break, we were talking about how is robot assisted surgery different from the traditional surgery, and how are surgeons involved?
Great. So I would say control is the number one reason, because with robotic surgery, the surgeon is able to control multiple instruments at the same time. More than just two instruments. More than using our two human hands, we can use 4 mechanical arms that we can control in real time. As opposed to laparoscopy, for example, when we are using minimally invasive techniques, but we only have our 2 human hands that hold two mechanical instruments, and we have to heavily depend and rely upon the skills of the assistant. In robotic surgery, we also have an assistant at the bedside, but it's not as crucial because we assist ourselves more. So I would say that's the number one difference, but also the efficiency of the work, ergonomics, more finesse, more precision.
Yeah.
So it's almost like doing open surgery with my own hands inside the patient's body, but through small incisions.
That is pretty cool. So who is a good candidate for robotic surgery?
I would say anybody who is a good candidate for minimally invasive surgery is a good candidate for robotic surgery.
Okay.
So if you think about it, most patients, except in cases where, for example, if the patient has had multiple operations and there is a higher risk for complications with small instruments, with adhesions, a lot of scar tissue in the abdomen, for example. But even then, we do robotic surgery.
Okay.
We start that way most of the time.
Okay.
So there are very few contraindications. You know, example, if somebody is in poor shape in terms of their heart, if the heart can't withstand the pressures generated by the CO2, then it's better just to do it open from the beginning.
Okay.
So those are very specific examples. But I would say there are very few contraindications. And anybody who meets criteria for minimally invasive surgery is a candidate for robotics.
Very cool. So what is the recovery time for patients that have the robotic surgery? Is it less than the traditional recovery?
Definitely. And it varies according to the procedure, but we now, as we mentioned, we have patients undergoing colectomies and they go home the same day and they recover within a week or so. We have patients who undergo major abdominal wall reconstruction and they recover within the next 3 days or so.
So the first surgery that you mentioned, how long would they have done if they had gone through the traditional surgery?
Oh, I would have been at least 5 to 7 days in the hospital, recovering over the next 4 weeks. It's a big deal.
It makes such a big difference. I mean,
absolutely, and not only the pain, Sasha, but also the return of bowel function. It would take a long time for the patients to start having bowel function, passing gas, having bowel movements, things like that. With the benefits of robotics, it happens almost the next day or so.
I'm like mind blown. Like that's crazy. Like you would never think that, and the fact that it's minimally invasive, like that's the best part. I feel
that's the best part.
Yeah. So, are there specific conditions or procedures that are better treated with robot-assisted surgeries?
I would say all conditions should be able to be treated with robotic surgery, and especially the difficult ones. I love tackling difficult complex cases with the robot because it makes it easy for me. It's more ergonomic. It makes more sense. It's almost like moving my own hands in the patient's body.
Yeah.
So even the most complex cases can become more simple thanks to the robotic technology. Even simple cases, though, I would argue. Some people say, oh, no, the robot should only be used for complex cases. Well, surgeons who have not mastered their learning curve so much, they have that bias. But once you do thousands of cases and you go over your learning curve, you understand as a surgeon that you could also use it for simple cases because you're more efficient. And in reality, one of the main criticisms is finances. And that's one of the questions I imagine you're going to ask me. And yes, when surgeons are not being careful and they have not mastered their learning curve, they take a longer time to perform the procedure, understandably, but sometimes they end up using lots of instruments that are really not necessary. So it keeps the expenses higher. So when you are a surgeon who's mature enough to understand that you need to save money, keep it on the cheaper side, be efficient, then you realize that robotic cases are actually less expensive than laparoscopy. Okay. So you can get to that point as a surgeon, and you just have to be efficient and financially mature.
Very interesting. And what are the pros and cons of robotic surgery? So give us the pros first, and then we'll go to the cons. The
pros are the benefits of minimally invasive surgery with less bleeding, more tissue finesse, with finesse and dissection, which translates into less trauma to your tissues as a patient, and a less pronounced inflammatory response when you're trying to recover after the insult, quote unquote, that is surgery, right? Yeah. The cons would be, one of them could be the financial aspect. If the surgeon is not mature enough to understand that concept that I just mentioned.
Right.
So the finances. So yes, it could be more expensive, definitely. We're not going to sugarcoat it. It could be more expensive if the surgeon is not mindful about what instruments are being used and not efficient and takes forever to do the procedure. But if a surgeon has been properly trained, has already gone through this concept and understands it very well, he or she can perform a very efficient operation in less time than it would take laparoscopically, because it's more efficient, and for a lower cost, because you're saving on instruments.
Yeah.
You don't have to use fancy advanced energy instruments or staplers. You can actually hand saw old school, like using your own hands, like it used to be done last century. Because you have this amazing technology that enables you to move your hand, your instrument, almost like moving your own hand. So you can keep it on the lower cost side. So that would be one of the cons. I can't think of anything else, because what else could happen with a technology that enables you to have surgery in a minimally invasive fashion? Some people say, okay, so Dr. Oviedo, what about the fact that, what if I have major bleeding, okay, and you're not right there with me at the bedside? It's okay. I have 4 mechanical arms I can control, rather than controlling my own hands, which may become under the stress of may go under the stress of tremor and the pressure generated by being in that stressful situation, even though I'm trained to handle it. Well, with these mechanical arms, they have no tremor. They don't shake. They're stone cold stable, and I can control them at the same time. So that's not even an option. Besides, I'm only a few feet away from you. If there is an issue, I can always scrub back in. I have a skilled assistant at the bedside. And we were talking about telerobotics, the way the future will be and all of that. Well, if I were doing a telerobotics procedure on the other side of the world, there would be a surgeon at the bedside anyway, right? So that's not really a con, I would say.
Yeah. Oh, wow. That's very interesting, knowing that there's only one con, which is price. I like that. How does a surgeon train for robotic surgery?
Great. So that's a great question. There are different pathways. I'll tell you mine very briefly. I graduated, had the honor of graduating from Houston Methodist General Surgery Residency Program here in Houston at the Texas Medical Center. Incredible program. But back then, years ago, I graduated 9 years ago. Back then in residency, we had no opportunity to use a robot. It was only reserved for urologists and gynecologists. So then I went on to become an attending surgeon in Florida for FSU College of Medicine. I did teaching, etc. I further trained. I obtained my robotic certification by training on my own, by interacting with industry, going on the circuit, learning from the experts, the best of the best in the state of Florida, then throughout the United States, case observations, discussions with the professors, doing labs, simulations, skills labs, etc. It's a very long process to train. It takes about 6 months or so minimum, depending on your commitment level. And then you do proctor cases. When an expert comes in and sees you perform an operation safely, then the credentials committee will give you your credentials, and then you continue to master your learning curve. You continue to adapt and learn. Okay. That's one pathway.
Okay.
But for programs like ours now at Houston Methodist, I was recruited by the chair 2 years ago to be able to bring Houston Methodist to the level of other competitors in the area and to become a leader. And I'm very proud to tell you, it's not just because of me, it's the teamwork. Because of what we have achieved, when I joined, there was only one faculty member in the Department of Surgery who performed robotic surgeries. Now, more than 20
Wow.
faculty. That's 200% growth, if you think
is
about it.
great.
More than 20 faculty are performing procedures all the time, and which creates problems because now we really need more robots, right? But that's a good problem to have.
It's a good problem to have, yeah.
So what I'm trying to say is, to give you a short answer, the other pathway is to be blessed enough to be in a program like ours when residents get trained from day one.
Yeah.
By the time they leave, 5 years later, they are experts in robotic surgery. You see, so they already have their certification, they have their numbers, they can enter and join the workforce and be proficient at what they do and do safe surgery on their patients.
Very cool.
I have a question for you. So, like you said, you went in Florida and then you found a pathway, right?
Yes.
So, what got your interest into robotic surgery?
Yes.
Yeah.
No, great question. You see, when I was a little kid, a long time ago, I always said I wanted to be an engineer.
Okay.
Okay. I loved engineering.
Okay.
But then ultimately I chose medicine. My parents are physicians who were retired, and they never told me to become a doctor, but I wanted to do what they do anyway.
Yeah.
When I was a resident in general surgery, I always looked at the urology residents performing robotic procedures, or the attending surgeon, the urologist, who's now a friend of mine, by the way, and I said, I wish that were me. I really wish I could touch that machine and learn, but we were not allowed.
Yeah, and that.
So that motivated me to learn something I did not know how to use.
That's
and I wanted to combine my passion for engineering with my passion for medicine, and where engineering meets medicine is in robotic surgery. If you think about it.
Yes. Wow.
So that motivated me, and I interacted with the industry, and I said, I want to do this. They supported me, and the rest is history.
Yeah, that's amazing.
We see the passion.
Yeah, we see the passion.
Definitely.
Absolutely.
Yeah.
Yes.
Thanks.
So do you foresee artificial intelligence play a role in robotic surgery?
Definitely.
Yeah.
Definitely. It's already happening.
Yeah.
As a matter of fact, 2 months ago, I was interviewed for my expert opinion by a company from Turkey that was doing a story on a group of scientists from Johns Hopkins University, who this group of scientists and engineers designed a robot called STAR, S-T-A-R, which is a clever acronym. This robot is able to create a small bowel anastomosis. Anastomosis is a Greek word that means connection between two organs. This robot is able to connect a piece of intestine with another piece of intestine in a pig through a series of experiments on its own without assistance from human hands. Because it has been programmed to learn and adapt.
Yes.
It's already, that's just a prototype.
Yeah.
It's coming. That's not the only group in the world that's doing that. Other groups are already designing, creating artificial intelligence adaptations to use with robots.
Wow.
Yeah.
And that could be, for example, like we were describing before with imaging navigation, recreating the pathway, and I could say, robot, show me the pathway to get to that organ in an environment full of adhesions or scar tissue where you can't recognize things. Show me the pathway for normal anatomy, and the robot can connect to the CT scan or the MRI, show you the pathway, show you with arrows where to go, and then, okay, I can do this. And then you can navigate that, and all of a sudden you find the organ or the tissue that you were looking for.
That is
You see?
so awesome.
It's just an example.
Yeah.
And it's already being done, and it's already being designed. And we at Houston Methodist, at the Houston Methodist Institute for Technology, Innovation, and Education, called MIGHTY, we are already working on experiments designed for that.
That's amazing because they have a show on I think Disney. My kids watch it. That's how it's called Mighty Meds. So they are those superheroes who are doctors, and they're really young. So it's almost like a sci-fi thing. Like when you're talking now, I vision Iron Man, because he can do things with his hand.
Like Iron Man.
Yes, so
You
you're
see,
a
Leila,
superhero.
and kids nowadays, you have kids, Sasha, you have kids, I have kids. kids nowadays, they are different. They come with that knowledge. It's inherent.
Yeah.
I have no idea how, but I mean, it's the way that their brains work differently. They already understand technology. It's second nature to them.
Yes,
So imagine what
absolutely.
these kids, when they become doctors and surgeons, what they could do in the future with robotics and AI. It's just incredible.
It is.
Yeah.
And it's already happening.
Yeah, that's amazing.
Wow. We're going to have the next Doogie Howser. Is robotic surgery covered by insurance?
Excellent question. It matters a lot to our patients. And yes, absolutely. As a matter of fact, I'll tell you something. According to insurance experts, not according to surgeons, according to the insurance people, it's no different from laparoscopy. Therefore, it's recognized just as laparoscopy.
Okay.
In other words, surgeons have to always say robotic-assisted laparoscopic hysterectomy or cholecystectomy or abdominal wall reconstruction. We have to say laparoscopic so that it's recognized by insurance. And it is. It is. So it doesn't cost any extra to do it robotically compared to laparoscopically. It's the same thing,
Very
according to
interesting.
insurance.
Okay. And can robotic surgery really offer any benefits compared to laparoscopy? And I think we did cover that.
Definitely, yes. Yes, multiple benefits. Not only what we talked about with the faster recovery to exercise, to be able to exercise, do your activities of daily living, faster return to work, faster return of bowel function, cosmesis, all of those are nice. Less pain needs or better pain control, less dependence on opiates or narcotics, especially with the opiate epidemic in the country, right?
Yes.
All of that is nice and noble, but remember, the inflammatory response, that's the one message I want you to remember.
Yeah.
The most important one is the inflammatory response from your body is minimal compared to the other modalities.
Yeah.
Okay.
Wow. And then how is Houston Methodist positioned to become the leader in robotic surgery in your region?
Honestly, it's an incredible hospital. I can tell you, if I could brag about it for just a second.
Yes, absolutely.
It's an honor to work there. It's the #1 hospital in Texas for years in a row. It's the number 16 in the nation. When before it was number 20, we moved up 4 to 16.
That's
In the
amazing.
future, we'll be in the top 10, and we'll be
wow.
competing for the top 5. And honestly, it's not the beautiful facilities. It's not the fact that now we're going to have another multi-million-dollar tower built thanks to philanthropy to take care of our patients and increase the number of beds. All of those things are nice. It's not only mighty, the training facility that we have, which is fantastic. It's really the talent of the people that work there. It's really the people, the human aspect of it.
Absolutely.
And my colleagues, the nursing staff, the technologists, the technicians, the surgeons, the non-surgery doctors, the medical doctors. It's just amazing. And so it's such a high quality environment that it promotes collaboration. And I can tell you, as a surgeon and as a scientist, I am collaborating with PhDs, with scientists, with engineers, and all of that only makes the system better. It makes Houston Methodist even better. So we are positioned to be a leader not just because of the philanthropy, not just because of the community and the help that we provide and the help that we get as well. It's not just the facilities, not just the Texas Medical Center, which is the largest medical city in the world, which is out of this world. It's just incredible. It's really the quality of the people.
Wow.
And if I could tell you a little anecdote, a little story,
Yes.
I was meeting with some industry representatives. I interact with industry. As a director of robotic general surgery, I have to interact with different industry that wants to bring technology to Houston Methodist. I was interacting with this company from China. Okay. And they were centered in one of the major cities in China. Incredible skyline, of course, many more buildings than Manhattan, than Lower Manhattan. And sure, all of that is beautiful, right? But then they were bragging about that in a good way. And then we were having dinner at the Texas Medical Center, okay? And then they left. We exited the building, and they asked me about the Texas Medical Center, and I told them it's more than 60 research education institutions in a downtown that is it resembles a downtown that is actually bigger than downtown Dallas. I was telling them all these things, right? And they said, "Wow, we don't have that." You see, so even in a city of their proportion where they are, and I don't have to name the city. You can imagine
Yes.
which one it is. With a beautiful skyline, with all of the, yes, absolutely. They don't have a Texas medical center, which is a blessing. It's an incredible group of facilities, and the expertise that we have at the Texas Medical Center is extraordinary. And so I think that's why Houston Methodist, being at the epicenter of all of that, is well positioned to be a leader in the future and go to the top 10.
Yes, that's amazing.
Love it.
And just a personal experience, because I've delivered my little one at Methodist, and I had my older one somewhere else, but the nurses there, oh my God, the
staff,
way they
everyone.
take care of you, staff, everyone. But I remember those nurses still today, and it's 7 years that they are so warm and so caring, attentive to your every need. So yes,
Absolutely.
you have amazing people.
Absolutely. And the same stage is true of all the Houston Methodist hospitals, by the way.
Okay.
Not only the one at the Texas Medical Center, the main one. My little one, my youngest one, was born in Sugar Land.
Yeah, me too. I'm
Houston Methodist
Sugar
Sugar
Land.
incredible.
Yes.
Same
Yes.
quality.
Yes.
Same quality. So I'm speaking on behalf of all of the hospitals. You can tell I'm very proud of it.
Yeah.
Well, I see that.
Yeah,
we see that, definitely.
Yes.
So, why do Houston Methodist robotic surgeons recommend robotic surgery to their own patients?
I think I speak on behalf of my colleagues at Houston Methodist, not only general surgery colleagues or colorectal bariatric surgeons who perform surgeries like me, but I'm talking about all of them, urologists, gynecologists, ENT, you name it. I think we all agree with the fact that we recommend robotic surgery to our patients because we would recommend it to our own beloved ones. We would recommend it to our own family. In fact, if I were a patient, I would like it to be done, my surgery were done robotic. I mean, to me, the personal touch is everything for a doctor. So yes, you can quote literature, you can quote technology, we can talk numbers and all of that. But at the end of the day, the people that we love the most are families. If it was a family member, I would recommend the surgery to be done robotic.
Yes.
I think that's the bottom line.
That's a big vote
That
of
sums it up.
confidence,
And
right?
I keep hearing that from my colleagues. It's the same thing, and that's why we always try to promote it.
Yeah, absolutely.
Wow.
Yeah, amazing.
Where has the time gone?
Yeah,
It's
it went
crazy
so
when you're in
fast.
such a good conversation. You just don't want it to end.
And my eyes were just
Wow.
hot.
Tell me more.
Yeah.
Now it's time for a chai tea.
Yeah,
Yes, it is. Well, thank you so much, Dr. Oviedo, for joining us. I mean,
Thank
we
you.
really appreciate you taking the time out of your busy schedule and on your day off, actually,
My
to
pleasure.
be here with us. And we appreciate all the knowledge that you have shared with us today, and we want you back.
Yes.
I
We
will
really
be
do. I
delighted.
think you're such a great conversationalist, and also just so much knowledge that you have shared with us today. And going in next Monday, I think I'm going to be very comfortable. So thank you so
Excellent.
much.
Thank
We
you, Sasha, and thank you,
appreciate
Layla. It's a pleasure.
Chai Time team, our wonderful listeners, thank you for tuning in with us here on Chai Time on 99.5 FM. We will see you next week. Same time, same place. Have a wonderful week ahead, and take care.